Yeah. My training was in traditional brackets, and that's all that there was available at the time I graduated. And so I learned to use those and did my best to do good work with them. Uh, so a little history about orthodontics. Our field is over 100 years old, and the first appliances were really pretty primitive. Um, the very first ones that we'd actually drill a hole in the tooth and put a screw in the hole, and then tie silk thread around the screw and pull that tight. And then the patient would come back a week later and you'd pull it tight, tie it again, pull it tight, tie it again. Now, I didn't do these things. These things were done long before I started the career. But the historical accounts are that that's the very beginning of orthodontics. So you can imagine that pretty quickly, orthodontists in those days tried to find a better way than drilling a hole in the tooth and putting a screw in it. Um, so then the next advance was to put a little ring around the tooth, a band, we called it, sort of like a wedding band on your tooth. And they would take a little hammer and chisel and pound those little rings on people's teeth. And they need to manipulate them, solder them, do different things with them. And stainless steel had not yet been invented. And so actually what was used at that time was gold. Alloys of gold for the little rings and alloys of gold for the wires that provided the force to move teeth. So in the beginning, orthodontists would stretch that silk cord tight and then retie it every week. And then the thought was, well, if we use the wire to connect tooth to tooth to tooth and tie the teeth to the wire, if there's a bow in the wire and the wire straightens out, maybe that'll move the tooth along with it. And so that was done. And the wires were gold. Gold is a particularly poor substance to use in orthodontics because it's like lead. It's soft. You bend it, and it stays bent. And we really would like something more springy than that. So then the next advance in orthodontics was the invention of stainless steel, both for the rings around the teeth and for the wire. Big advantage of stainless steel is it's springy. Now, if you bend it too far, it'll kink and stay bent and not deliver a force to the teeth to move them. But it had a much broader range of motion than gold did. So that was a huge advance. The problem with stainless steel, you can think of piano wire, is very stiff. It's springy, but stiff. And so the potential was to put way too much force on the teeth. Also, I talked about putting a screw in the teeth and tying a silk thread to it as a way of attaching the tooth. Well, when stainless steel came about, then the primary way of attaching the handle on the tooth, which is the bracket, to the wire, which is the force, the springy force that moves teeth, the way of holding those two together was to tie them together with a piece of steel or later on an elastic band. That was an effective way of fastening the wire to the bracket. The problem was that way of attaching the wire to the bracket introduced a lot of friction. So if you wanted to slide the tooth along the wire, you had to use a lot of force to move it, to make it slide, to move it. And that's where Dwight Damon enters the picture and the Damon brackets. So Dwight Damon is a very inventive man, and he set out to create a bracket that you didn't have to use a tie wire or an elastic tie. The motivation for that, oddly enough, was not to reduce the force on the teeth or to do what we now know Damon brackets do, but it was simply to make attaching the wire quicker and easier. Because as you go through treatment, you take out a fine wire, put in a little stiffer one, and then the patient returns in maybe 4 weeks. You take that wire out, put a new one in, and each time you remove and replace a wire, you have to take all of those little ties off and put all new ones back on. It's a procedure. So he said, what if I invent a bracket that has a little gate on it? So he opened the gate, pushed the wire in, shut the gate that quick. That would be a really cool thing. So he, in fact, invented that bracket and started using it in his practice. And before long, he discovered that the patients that had his style, we now call Damon Brackets, had his invention on them. Those patients, their teeth moved much more quickly, and they had much less discomfort. And so he scratched his head and said, what's going on here? You know, it's not what I intended, but treatment's going faster and it doesn't hurt as much. And what he discovered was that by using a gate on the bracket, he didn't tie the wire so snugly into the bracket and create that friction. And so the thought is, without as much friction on the bracket, the wire, even a small fine wire, springy wire, can express that force gradually over time. And that's what made the teeth move faster. And because you could reduce the force to the teeth, that's what made it hurt less. So there's a combination now that we use, the Damon Brackets and a nickel titanium alloy. It's a wire that's not stainless steel anymore. It's a nickel titanium alloy. And if you pick this wire up and wiggle it in your hands, bend it, it's very, very resilient. So you can bend it into a loop and then let it go and it straightens right back out. And when you're fiddling with that wire, you feel how soft it is, how easily it is to bow the wire. But the wire doesn't kink easily. It's very hard to kink that wire. So it's an ideal wire. The problem with that wire was we tried to use it in traditional brackets with the wire ties and the rubber ties. There was so much friction in the way we attached the wire to the brackets before Damon that that light force, we couldn't really take advantage of it as much as we needed to, because you needed heavier forces to slide the teeth along the wire. Enter the Damon bracket. Now you have a way of almost friction-free. We call it passive ligation, passive tying. Put the wire in, shut the gate, the wire can slide easily in the bracket, or the bracket and tooth can slide along the wire with much, much less force. So that's when the potential for these nickel titanium wires really took off, is because now we could take advantage of the very light force on the wires. So as a consequence of using the nickel titanium wire, we can use very light forces, and these wires, you can deform them greatly. And over time, they just keep straightening out, straightening out, straightening out. And that happens without taking out a fine wire, putting in the next size, taking that one out, putting in the next size. You can use a very light, fine wire, just leave it in, and the teeth unravel and unravel and unravel. So the nice thing is, it doesn't hurt as much. The teeth move faster. And a really nice bonus of that is the patient doesn't have to come in every week, 4 weeks. We can see patients every 10 to 12 weeks for their adjustments.